10 fatty liver symptoms. Our livers perform a very important function in that they help to cleanse the blood of toxins and anything else that isn't wanted. For the most part, it does its job 24/7 without us even noticing it is there. Sometimes, though, problems may occur with our liver, and this can cause a range of complications. Among the most common problems encountered is fatty liver syndrome. As the name suggests, this means that the liver has started to accumulate deposits of fat. This inhibits the organ's ability to work as well as it should, causing a variety of symptoms. While fatty liver syndrome can be overcome with healthy living, it can be life-threatening in advanced cases. 1. Obesity. One indicator of fatty liver syndrome is a larger than usual belly. A person does not necessarily have to be obese in order to have fatty liver, but having the condition is likely to encourage weight gain. This is largely because the liver isn't functioning at full capacity, leading to a drop blood quality. In turn, the sufferer will turn to more food to compensate. There are many potential causes of obesity, but you should still seek a diagnosis if you are suffering from other symptoms as well. Even if you are not suffering from fatty liver syndrome but are still obese, it is still advisable to do what you can to reach a healthy weight. 2. Binge eating. Obesity is usually caused by eating too much and/or insufficient exercise. The intake of food can be steady, but one symptom of fatty liver syndrome is binge eating. Sufferers will often feel hungry all of the time and will have cravings for significant amounts of sugar-rich foods. It is these cravings that help to contribute to obesity that is so often associated with fatty liver syndrome. Monitoring your calorie intake is very useful in helping you to regulate what you eat. Sugar and carbohydrates, in general, are a major cause of obesity, as well as foods that are high in fat. Binge eating is potentially very dangerous to your health regardless of any underlying cause. 3. Dark urine. The liver is mainly responsible for filtering toxins and any other unwanted elements from the system. Fatty liver syndrome inhibits the liver from doing its job as effectively as it should do, meaning that fewer toxins are filtered from the system. When these toxins are not removed by the liver, they tend to be passed from the body in urine. This causes the urine to become darker in color because of the increased number of toxins present. In addition to a darker color, it can also take on a stronger and more obnoxious odor and may also become painful to pass. You should seek medical assistance if you have these symptoms regardless of the suspected cause. 4. Abdominal pain. Pain in the abdomen is often a strong indicator of disease of the liver, include fatty liver syndrome. Such pain is felt in the right upper part of the abdomen. The pain is often a result of bleeding from the liver. This can lead to vomiting, with hints of blood and the vomit and blood may also be present in the stools. If you are experiencing pain in the abdomen, then it is advisable to book an appointment with a doctor. If you are passing blood through stools or through vomiting, then you should make an appointment as an emergency. 5. Jaundice. Bile is a substance that is produced by the liver and helps to break down fats. With fatty liver syndrome, however, the ducts that release the bile become blocked, diminishing its presence in the system. This leads to various unwanted compounds circulating throughout the body, which leads to a condition that is known as jaundice. Signs of jaundice are the skin and the whites of the eyes taking on a yellow tinge. Jaundice may also produce small, yellow and itchy bumps around the eyelids. It is a strong indicator of the fatty liver syndrome and other liver complications, and you should see a medical professional if you suffer from these symptoms. 6. Poor complexion. In addition to jaundice, the fatty liver syndrome can also affect the complexion in other ways. Spider veins are a collection of blood vessels near the surface of the skin that are clearly visible externally. They are so called because they will tend to spread out in the shape of a spider or a spider web. They are an indicator of various problems, including fatty liver syndrome. These veins will often show themselves on the legs, and broken vessels can also be found on the face. You may also experience a discoloration of the skin in the neck area, along with the swelling of the glands. Sufferers will also tend to experience a general darkening of the skin, with the palms of their hands turning bright red in color. 7. Fatigue. Our bodies are usually quite good at fixing problems should something go wrong. The liver is no different, and should you acquire fatty liver syndrome, then your body will go into body repair mode. To help with this, lots of blood will be sent to the liver to supply it with oxygen and nutrients. In prioritizing oxygen and nutrients for the liver, however, these additional resources are being taken from supplies that other organs would have received. This can leave us feeling low on energy and, with the brain not getting all it needs, we can also become confused and have difficulty concentrating. In this case, we will need to help our liver recover so that resources can be distributed evenly again. 8. Ascites. Ascites is the name for a tight, distended abdomen caused by excess fluid retention. It is a strong indicator of liver disease, including fatty liver syndrome. Because of the pressure being placed on the internal organs by the excess water, it can also become difficult for sufferers to breathe. In addition, some of the excess water can also be pulled down into the legs and ankles by gravity. Such symptoms are clear indicators that there is a potentially serious problem and you should see a doctor as soon as possible. Treatment will often include diuretics to help the patient pass excess water, although it is most important to treat the root of the problem. 9. Muscle atrophy. One of the liver's responsibilities is to help metabolize proteins which are supplied to our muscles. Fatty liver syndrome inhibits this process, leading to an insufficient supply of proteins. This, in turn, causes the muscles to waste away, causing the sufferer to become visibly thinner and physically weaker. Muscle atrophy usually only occurs as a result of fatty liver syndrome when it is an advanced stage. It's potentially very hazardous to your health and you should seek assistance as soon as you can should you experience these symptoms. In addition to muscle loss specifically, any case of sudden and unexplained weight loss should be treated with some alarm. 10. Heredity. Although heredity is not a symptom, a history of the condition in the family is an indicator that you too could be suffering from it. This is especially the case if you have other symptoms associated with the condition and could be helpful in reaching a diagnosis. If you do know that family members have suffered from fatty liver syndrome, you should let your doctor know. If there is a history of it in the family, then you should take extra precautions to avoid developing the condition yourself. This means a healthy diet and drinking alcohol in moderation. Healthy eating can help prevent anybody from acquiring the condition, not only those at a higher risk of inheriting it.